If you test positive for COVID, experts at the CDC now say you no longer need to stay home and isolate for 5 days. They doubt most people were anyway. Casey Nolan walks us through the agency's new guidelines.
COVID is still with us and likely always will be, infectious disease specialists say, but the restrictions around it are starting to fade away. Friday, the Centers for Disease Control and Prevention dropped its guidance of 5 days in isolation for a positive COVID test. The CDC now says people can return to work or regular activities if their symptoms are mild and improving, and it's been a day since they've had a fever.
We still see a lot of people having to be hospitalized either with COVID or with the flu, but for the most part, most people aren't as severely ill as they were, say, 2 years ago.
Early in the pandemic, COVID-19 was the nation's third leading cause of death. Last year, it dropped to 10th. The CDC says Friday's guideline changes are an effort to align COVID recommendations with the flu and other respiratory viruses.
More people have been vaccinated, more people have had a COVID, flu, etc. The more times you've had this, you build up better immunity.
The CDC still recommends masks when infected and vaccines.
We know vaccines work. We have data from the first half of the season that shows that if you got a vaccine, it's really protective, and that the people going to the hospital, 95% of them did not have an updated vaccine.
And doctors caution that COVID is still dangerous for the immunocompromised and can still cause long-term health problems even for otherwise healthy people.
And the most important thing is that people just stay home if they're feeling ill.
We also heard from doctors today who are worried that employers will use this new guidance to require employees to come back to work before they're feeling better and before they are less of a risk to others. We also heard from the American Association of People with Disabilities. They worry these relaxed guidelines could have deadly consequences for the people they represent, saying that the goal should be to take all viruses more seriously, not take COVID less seriously.